Well, now that the recording has started, Amanda, I had coffee yesterday morning with Dan from the Diocese of Helena,
Oh,
communications director, something, something.
yeah, he's the interim ED for Good Sam.
Yeah,
Yeah.
spoke very highly of you.
Oh,
You
well,
have a
thanks, Dan.
fan. Yeah, Dan is a fan for sure.
Yay.
So,
Yeah,
Amanda
we
and have a way of making that easy, though.
oh, well,
You guys are both
thanks.
wonderful.
It's he's stepped into a tough role there, and we're trying our best to help them move forward with an allocation that the city commission made a couple of years ago and get them on a good path. So
oh, good.
they're in good hands, though, it seems, with Dan. He's been very easy to work with. So
Which Dan?
Awesome.
what is Dan's
Oh.
last name? Bartleson.
Dan that was at Carroll College before? What's that? What'd you
I'm
say,
not-
Amanda?
Dan Bartleson is his.
Oh, Dan Bar, sure.
Yeah, I'm not sure. I didn't know Dan until he stepped into this role with Good Sam, so I'm not sure what his
Sure.
background
No, I
is.
know who you're talking about now. Yeah.
Hello, Commissioner.
Hi, Commissioner.
Hi, Commissioner. Hi, Colleen.
Hi, Commissioner. Hi, Colleen. Happy Friday. Is it Friday or Thursday? It's Thursday. Sorry.
Feels like Friday.
Friday on a
Yeah.
Thursday.
Friday on a Thursday.
Amanda, will the mayor be joining us today?
Let me double check and see if he accepted the meeting here. He did accept.
Okay, maybe we'll wait another moment and see if he joins us. Then we can go ahead and get started.
Okay.
I apologize for my camera not being on. I'm still technically on vacation and I've been out weeding all morning, so I'm not going to subject you guys to that.
No worries. I'm the reason that we pushed it a little bit anyway, Colleen. So blame it on me.
No
Hope you had
worries.
a nice vacation.
It was nice. Yes, thank you.
Good.
We didn't come home with any fish, but
Oh,
well.
Where'd you go?
We went to Alaska for 5 days with friends, and David and his best friend went fishing, and so they didn't catch any halibut.
Mm.
I'll have to give him a hard time next time I see
Yeah.
him then. Bring him a Costco. Bring him a Costco one.
Yeah.
Mm.
There you go. There you go.
Well, so long as everyone's okay, I'll go ahead and get the meeting started. And if the mayor joins us, he can add any feedback he has. But it's 1:32. I'll go ahead and call this meeting to order and we'll do roll call. So James Petrovich,
Here.
Commissioner Rolfe,
Here.
Colleen Smith,
Here.
and noting that Mayor Collins is absent. And so we have a quorum to go ahead and discuss some funding recommendations and vote on whether or not we'd like to recommend any of these applications for funding. So we can go ahead and start with the YWCA, the WINGS program. And does anybody have any from Miss Denise King? She was the one that presented that. I can start. I had a slight concern that it was more of a supplemental funding, that it wasn't going toward programming. So looking at the funding of it and kind of what our mission is, it didn't quite fit in my perspective, but I don't want to diminish the work that they're doing. And I understand that it kind of tertiarily benefits opioid use disorder, but it wasn't as direct as I feel that our mission is. Anybody else have thoughts on that?
I agree. I think reading it initially, I mean, I think looking at the shelter, subsidizing the shelter and then providing staff training is all really important stuff. I think when I asked what proportion of your clients have an opioid use disorder of some kind or another, and she very quickly said all of them.
Yeah.
I don't, I mean, not that I don't I mean, that wasn't, to me, that case wasn't made in their proposal. It was something we had to ask for. I take their word for it, though. I think what I would be amenable to, since it's not a huge expense, it's not a lot of money, is supporting the cost, the shelter support. I would be amenable to providing that. But I would want to see a little more specific discuss. Maybe next year they could provide like a more specific plan for training for the other $15,000. That was much more specific to opioid use. Maybe that was in their proposal and I missed it, but the shelter piece was compelling to me. Maybe it's because homelessness is an interest of mine, but the training piece I could do without.
So would you be recommending getting a kind of an updated application that goes toward their funding or goes toward the program or funding for the nights of shelter? Because I don't have it written down, but I feel like she even told us it costs X number of dollars to fund shelter for one night for all of those that may be there. Is that what you're more so looking for? Is that what I'm understanding?
I think what I would do just to make a decision is to say, we will give you the shelter funding. We'll give you $35,000 for the shelter, but we will not give you the $15,000 for the training. They could, if they wanted to come back next year, which I don't remember if this is a multi-year grant or not. It may not be. But I personally, and maybe I need to read the application again. I didn't get a really strong sense that the professional development plan was super robust and really targeted towards opioid use. If others disagree, please let me know. But I am supportive of the shelter funding, though.
I am kind of in the same boat as you, James. The training I think is super important, but some of it just was not like, I'm looking at their list here. The gambling and gaming disorder assessment, I don't think that fits. I mean, so I think a lot of the other pieces do. Looking at co-occurring family systems, and if truly every woman does have an opioid use, I mean, disorder, then it's going to fit in there. But like the proposal writing boot camp, Excel specialization, medical billing and coding. I mean, all those together is only $400, but.
Mr. Rolfe, do you have any thoughts about the YWCA, or Colleen, do you have any others? And if you were still just thinking, Colleen, I'm not meaning to cut you off.
Yeah, no.
On their program for YWCA, because it's kind of a long-term approach to things that carry people for a long time. But you're right. I think you're right about it being. It's going to be a little bit hard to tell because it's a small part of their total deal, so it really makes that big of an impact. I kind of like James' approach. You be part of it with encouragement to come back and show us how we can know that we're making a difference.
And Commissioner Rolfe, I heard about a quarter of what you had to say. I apologize. I couldn't quite understand. I was hoping that it would clear up, but it didn't.
So I was just saying, can you hear me a little better now?
Yes.
We got a little closer to the mic. All right. What I'm saying is that I basically like their program because it's a long-term approach and they stay with people a long time to help them get well. And I think that, but I do have some problem with the fact that it's a little bit hard because it's such a small piece of the program. Are we really having the impact we'd like to? I think I like James's approach of maybe giving a partial amount, like for the housing, and asking them to come back, with a little more requests next year. I think I would go along with that idea of doing the 35 for the housing, and then let's see, how do we know that we're having an impact? We need to have a little more specifics that we're having an impact on.
So what I'm hearing is that you would be amenable to what James's thoughts are, $35,000 for the shelter funding, but not going above and beyond that. And if they wanted to apply for additional in the future, we would want to see more information about their programming and the outcomes.
Mm-hmm.
Is that a consensus from all of you? Do I hear a motion on that?
I'm just gonna go back to the training piece again. It's really hard to find LACs. And I think if we can provide some money for them to get CEUs, which they have to keep their LAC, I think it benefits the whole program. I just hate to see cutting out the training piece, specifically for the LAC CEUs. Because their proposal, I mean, it gave the name of the person, it listed their current credentials, was the name of the training, the name of the facility, the duration, need for training, CEUs, the cost of books. I thought it was pretty extensive as far as how they outlined their training request. I don't know what else they could provide.
Is there anything you would want to see outcomes wise from the training, Colleen, in a report to us to make it maybe more than, to James's point, a little more sufficient?
Not me personally. I mean, I think what they've provided is enough for me. I mean, I printed it out and taped it. It was like 3 pages. So those are my thoughts.
Okay.
I mean, I appreciate that, Colleen, and I think, this may be where my recollection of the proposal failed me. I think as I look at the spreadsheet, which is helpful, I see definitely pertinent trainings. I think one thing, and I don't know if this is for us, maybe this is something we potentially fund, is I wish the trainings were a little more, they're all attached to one person. And so if that person goes, then that training goes with them. And I think we know retention in a lot of social service agencies and Helena, as well as across the US, is a lot. I mean, I think if I could go back in time, I would say, can we support some trainings that are targeted towards a broader group of people that would really lift the agency? I mean, not just that one individual, but the larger agency, just to make sure we're maximizing impact. And if, Nancy leaves, then that training goes with her. I mean, I don't know if we want to get into I think most of the trainings, it looks like, that are dedicated towards Paige Sutherland are more generic, not necessarily as in line with what we're trying to support.
Yeah.
So if we wanted to say, hey, you can't do those, but then like you said, Colleen, the amount of money that they're asking for isn't that much. But in principle, do we want to make sure that we're reinforcing you need to have focused activities? So all this to say, I'm open to funding the training with some kind of caveats that, we may or may not want to support the more administrative, more generic trainings, and that we would really appreciate them being able to open up training to a broader audience than just 3 people. I mean, I think the agency probably employs more than 3 people. So that's just a thought.
Yeah, I guess my other concern would be, you say you train them and they leave. What if you don't train them and they leave? Then you've got other people then you have a hole, and you might have to then still go back and retrain those folks. So I think it's a good workforce piece. So workforce towards the addiction piece. So I don't know, I'm just kind of a pro training person.
Mhm.
Well, I think you've made some compelling points.
Mhm.
I am more open to it after hearing some of the comments. I would want to see some pieces, and Anne and Amanda have been really good at helping to funnel this, that we could ask for this to be, that we would be, if there's a motion, we would be open to the training, but we would like to see more staff trained than just the 3 individuals listed. And we would like to learn more about it in their upcoming report, that we would want to see a 6-month report, unless you would want to see it sooner.
I
Along with
like
funding
that.
for the shelter. So do
Yeah.
I hear a motion for that then?
So moved.
Did you get all
Second.
that, Amanda?
Oh,
What the
sorry.
motion was?
Approved as written, but with the caveat that we'd like additional information on, I guess if they want to apply again next year.
Mm.
Yeah, I don't know what I'm trying to say.
Mhm.
Amanda, what's your question?
Mr. Chair, so just to clarify, if I could, so the motion is to approve their full request as proposed, with a request that they provide additional information related to the outcomes from their training at the 6-month report mark.
Mhm.
And the lingering question I suppose that I have, there was also talk about potentially taking the generic, or
Mm.
it looks like it's training that's geared towards the person that would be doing their data evaluation related to these programs. Would you like that to be taken out, or is it in total?
I guess I would leave that to Colleen, who's making the motion.
Right. I mean, I hate to say, yeah, we're going to fund everything, but the $435 seems.
Mhm.
Yeah, I agree. I just don't want it to come back to us later that if we draw a line with somebody else and say this isn't like really specifically opioid. I mean, we can say it's adjacent and it absolutely supports the evaluation of the program. So I think the case is fine. I just don't want us to put ourselves in a tough position later. But yeah, but monetarily, it's a minuscule amount. So yeah, I mean, I'm good with either or. Just thinking about potential ramifications for the future.
Well, and if you've got someone that has that additional training, maybe that puts them in a better position to apply for other grants or something if their data and eval is a little more solid. So it's an investment in long term, I guess, as long as she stays.
So I'm hearing a motion to fully fund the YWCA grant request, with the caveat that they provide detailed outcomes of training within 6 months, in addition to broadening their training to as many staff that may want to participate as possible. Does that amended motion suffice for you, Colleen?
Sure.
Sounds good.
Okay. And a second?
Yeah.
Commissioner Rolfe, thank you. All those in favor? Aye.
I
I
Any opposed? Okay, 4 ayes and 0 noes. Thank you. So we can let them know that that has been funded, or well, that request is being made to be funded. Excuse me, let me rephrase that. The second is Intermountain Deaconess Children's Services, the expansion of their day treatment program, where they would broaden that to more rural schools throughout Lewis and Clark County. They also mentioned that it may go outside of Lewis and Clark County, but it would focus on Lewis and Clark County. That it would allow for up to 10 new children and new classrooms, 2 new teachers, and would allow them to do more. One of the kind of concerns that I had of this was the $30,000 in bonuses. I struggle with that portion. But then I don't know if it would collapse without it altogether, if that's how they're attracting new care providers. But I am in favor of supporting the 1 year. And when we discussed this with them, even though this was kind of a clumped together item, they were open to being funded for 1 year. Other thoughts on that?
Was there thought on what we're talking about first, the 1 year number company?
I'm not sure I understood you, Commissioner. I'm sorry. With 1 year, what?
How much for 1 year are we talking?
It was $106,791 for the first year.
Okay.
Thanks, Amanda.
Mm.
Okay.
I'm just going to look at this a little closer too.
Yeah, and it was 15,000 for
Per
recruit
year.
bonuses
Yeah.
and marketing. And I can tell you, it is hard to try and find therapists.
Mm.
No, I get it. And we did the same thing in East Helena to attract police officers utilizing COVID funding. That's how we attracted some at the beginning. So I get it. I just struggle with this money going toward that. But I also understand that the challenge it is, especially for those individuals. And I think that this would be a really good example if they chose to reapply to what they could accomplish in their first year, and or to promote for other grant requests that they may have as well. Are there other thoughts on this one? Interests, concerns?
I like it. I think it's desperately needed.
Yeah, this is I'm not super familiar with this kind of world of services. So I'm happy to defer to y'all. I mean, the thing to me is I think anytime we start getting into, the kiddos focus services, it's more of a detached kind of association with opioid use. I mean, they're obviously, well, most of them I would imagine are not using opiates and they're not in rehab. They're not in the criminal justice system. I get that this is a prevention program. So if y'all are comfortable and convinced that the linkages are there, then I'm supportive of it as well.
And I should have been clear at the beginning, James, and you make a good point. Growing up in and around Helena, Intermountain, knowing what prevention services they do provide, just in the fact of providing a safe home life and stability and education, they do such great work that, yeah, that is the slant that I'm looking at it from, is definitely the prevention bucket, which I don't think we've done a ton with. some of our others have been more responsive to the needs. So knowing that we should have kind of cover the gamut, I like that it's prevention focused. Pauline, you probably know this world more than some of us with the prevention, but do you feel that way, or do you have anything to add on that topic?
Yeah, no, I agree. It's not primary prevention because that's stopping it before it starts. And these kiddos are already are already at risk either through their parental choices or, but I mean, with especially with opioids, they're easy to get, they're easy to hide. So, and one thing leads to another. So you really can't just focus on one substance when you're looking at prevention. So I am for this one.
Mr. Rolfe, do you have anything to add?
Yeah, I would go along with it. I think I do think that we might in the second year run into how much money we got. I don't know that we're going to have 226 in the second year. But I think we can justify the 106 where we're at right now.
Well, their little budget thing was kind of confusing because I don't think they're going to ask for the entire 226,000 from us over 2 years, because if you look under the 2-year abatement trust request, the total is 241,000, with the first year being 106.
Mm-hmm.
So I think they were looking at getting additional funding or being able to bill Medicaid for some of that.
And my hope is that starting this is in good faith. We are making kind of the initial investment for them to then be able to go out and either fundraise utilizing what benefits it provides, or being able to bill a number of things.
Yeah, and the text down below, the year one was full coverage for year one of program and expenses, and then year two was full salary for a newly hired mental health specialist, and then 40% of the salaries for the an existing therapist and teacher to expand services. So if they did the second year, they'd be asking for 134,642,000.
And I would just, if there is a motion for this to approve, I would say that it is in their report that we received back. It would be methods that they went about for opioid prevention to tie that a little bit closer, as well as a full understanding that there is absolutely no guarantee of a year two funding, and they would need to take that based on that knowledge.
Yeah.
And if they can't make it work on year one, then we would recycle this money for future use. Is there a motion to that effect?
I'll make that motion. I agree with what you said there.
Is there a second?
I'll second.
Okay. All those in favor?
Aye.
Aye.
Any opposed? Okay, so we are recommending the full 1-year funding to Intermountain as well. All right, the third project to review is the Montana Professional Health and Wellbeing Program, the HOPES for Health Occupation Professionals. They are seeking $80,435 in the first year. This was a program that would help travel the area to hopefully encourage more healthcare professionals to seek either treatment, recovery, or prevention for whatever their needs may be. I'll talk about my thoughts on it first. I think it's a unique program. I struggled with their budget. If this is to focus on Lewis and Clark County, their budget was if they were traveling a lot, so I don't understand that portion of it. I also struggle with the budget itself. It was very high. And one of the comments that was made is that there was new legislation to help healthcare professionals utilize employer-sponsored wellness programs. And I would personally like to see that there is what comes of that before we invest such an exorbitant amount. But I think it's a unique model. I think it's more fitting for a statewide application that doesn't quite exist yet.
I agree with everything that you said.
No. Well, thanks.
Yep.
I think right on target.
Okay.
I completely agree as well.
Amanda, were you able to capture some of those bullet points? Or Anne? Okay.
Mr. Chair, you were very succinct. Thank you.
Okay. Obviously it's recorded. So I would, do I have a motion to deny this application, providing them with those pieces of feedback?
So moved.
A second?
Second,
All those in favor of declining with the opportunity for them to receive some feedback that was mentioned? All those in favor?
I,
All those opposed? All right, Colleen, I didn't hear, and maybe I missed it.
oh, I
Did
did,
you?
I said aye, sorry.
Okay, that's okay. All right, well, thank you, and hopefully they can come back with something that will be helpful in the future. The last application that we had to review today was the Montana Meth Project, the fentanyl prevention, education, and outreach. This was to increase what they're doing, also kind of around the state, but they had a focus in Lewis and Clark County. It was a request of $35,000, working with teens and youth for prevention. One thing that one of the concerns I had was that it was a statewide application that was kind of honed for Lewis and Clark County, but they are doing it throughout the state. And then in addition was that it was prevention of fentanyl, but not really anything else. But and with changes in what's going on and what drugs are being utilized, that was just a concern I had. But I get the mission. So thoughts on this one?
Oh, I have some thoughts.
Okay.
So I watched it. They kept saying it was a 10-minute
Mhm.
training, which it wasn't a training. It was actually 9 minutes, and the first minute was an ad for the Montana Meth Project. There were some scare tactics, which is not best practice, and we do not use those with youth. My question was, has it been tested with a focus group? Because my thought was the kids that they're probably trying to target are not going to relate to their little wholesome spokesperson that they had. There was no, if it's a true prevention program, there should have been some skill building with it, but there wasn't.
Mhm.
There was no pre or post test to see if it was effective. I just know that whenever anybody has done something similar with high school, it just doesn't sink in. The Helena Education Foundation brought in Chasing the Dragon, which was an opioid, a horrible movie that should have never been shown to kids. But a parent asked later, like, well, what was it about? I don't know, something about drugs. So unless it's something where they're building skills that they then actually apply those skills and teach how to apply those skills, it's not effective. So I just feel like $35,000 could be spent way better.
One thing we've discussed is that we haven't seen a true prevention program.
Right.
come through, and for youth and teens, which is something I would personally like to see.
Yep.
I think you make good points, Colleen. As far as curriculum wise, you and James would probably be the best to know and understand that portion of it. It makes sense to me. One of the points that Ms. Rue made was every dollar spent on prevention saves $7 on treatment. I thought that was I don't know to what extent that's accurate, but it sounds fairly accurate. But so I really, really want to see a prevention program that can benefit our county and our state. But I have some concerns as well about it. I think it worked for the time, maybe at the time when it began, but I don't know that the same method is going to continue to work.
Well, the other concern is they haven't talked to the schools and they're not coming in with an MOU that, oh, yes, we are definitely going to.
Mm-hmm.
We found is, oh, let's do this. And then, the school district is, oh, and the parents are, having fits about it. So we don't even know that it would get played.
Sure.
I agree. Yeah, with everything. I think, Wes, what you said about it, being more specifically focused on fentanyl was something I took note of, although maybe that focus is warranted and necessary. I mean, it certainly seems to be a dangerous drug. I don't know. It feels like to me, and I don't know, some of the information that was shared during the presentation, when I went and looked at the website, which, I think someone asked a great question, where can I find the video? And I followed those directions and I went to the website and found this 10-minute thing. And it only looked like it had been watched 600 or 700 times. I mean, maybe I'm off on that, but I just felt like there were some discrepancies in kind of in the information that was being shared about kind of the exposure and how broadly things were being consumed versus, at least in that anecdotal experience. And then because I just do these things, I Googled Montana Meth Project, and there was actually, and we could probably dive into the methodology a little bit. There's actually a peer-reviewed publication study using, I think it was BRSS data. Yeah,
Yep.
about the Montana Meth Project. And basically, to quote the article, these results suggest the Montana Meth Project campaign did not contribute to the decrease in meth use among Montana youth.
No.
So there's that. And again, it just kind of feels to me like if they could come with something that's more targeted, more specific, that really to me reflected the context of Lewis and Clark County specifically, or some of the other outlying areas that we want to reach, that would feel good versus something that felt like it was just more of a broad brush, let's see what we can get approach.
And to Colleen's point that there will be buy-in from educational partners, I think is critical as well. Beforehand, not hoping so, and showing us that.
I mean, something that I was thinking about that actually I think goes back to the previous application, and I don't know if this is possible, and I don't know that we would want to do this, but it feels like if we see there are specific needs in our state, could the MOAT put out a specific RFP that says we want a statewide opioid prevention program that uses best practices and they manage that it's not a region or it's not an urban area. Same thing with the Hopes Project. The Hopes Project, just, I'm sorry to go back. It felt like, I mean, we're talking about licensed professionals. I mean, they have an invested interest, I would hope, in staying compliant. And this idea that people need to travel around the state to, table and put ads in publications that, I mean, these people have to get licenses. They have to do CEUs. I mean, maybe the MOAT needs to put out an RFP for required CEU training that goes through what a licensed professional is supposed to do if they have a substance use issue. I mean, that to me would be potentially a more efficient use of that kind of funding. So for what
Well,
that's
and the
worth.
state, yeah, DPHHS is getting money. So it would make sense for them to do something statewide,
Mhm.
but I'm not sure that's going to happen.
Okay.
Well, for this, I do think that that's a great, maybe some feedback with what we approve and don't, Amanda and Ann, to mention that we feel that there is a lacking of a substantial qualified youth prevention. And either are other regions seeing something that is really great, or is there an opportunity for all of us to maybe buy into or recommend a funding for something that's working to do something statewide? So as an aside, for whichever way this vote goes, I think that that would be some good feedback to add.
That's a great point, Wes, because we don't know what other people are approving. And there may be some really great initiatives happening. But if we're all doing our own thing, which makes sense to have the kind of autonomy, but yeah. And Commissioner Rolfe, I'm sorry, I think I cut you off.
No problem. I just think you've all three brought up some questions that need to be answered before we go anywhere with something like this. I do think it seems like more of a regional, at least maybe statewide project, and I was disturbed that the one comment that Colleen made, that they don't seem to be connecting with the schools to find out what the schools want and move. So I would move that at this point we deny it and send the feedback that from these comments.
Am I hearing a motion then, Commissioner?
Yes.
Okay. Do I have a second?
Second,
All those in favor of denying the Montana Meth Project application?
I
Aye.
Aye. Any opposed? Okay. Well, that concludes the funding recommendations and not recommendations for today. And for this portion, we'll continue to take any additional applications and review them as they come, with giving time to the statewide trust to take into consideration our recommendations. Before we move on any further, is there any public comment on actions taken today or any other comments? Is anyone else online, Amanda and Ann?
Mr. Chair, it's just us.
Okay, I thought so, but in case there was you had a land of people that were out there, I didn't know. All right. Do you all have any other thoughts or anything you'd like to share for today?
I would like, oh, go ahead. Go ahead, Amanda. I'm sorry. I just had a thought I wanted to add on something we dealt with earlier. Go ahead, Amanda.
I'm so sorry, Mr. Commissioner, Mr. Chair. I just wanted to share just briefly. We are getting somewhat regularly, I think we've gotten a handful of these, but updates from the moat related to statewide allocations. So we've included those as they've come in. This is not. I think that this is just the most recent allocations that have been made in the last quarter, but something maybe to look at in terms of the conversation related to what other prevention projects are being funded by other jurisdictions.
Sure.
I'd be happy to send this out again too if it would please the committee.
Yeah, I'm curious, and I saw before the Yellowstone Boys and Girls Club, that's a very specific entity in a specific place, but we have facilities like that here in Lewis and Clark County that maybe could replicate or duplicate something similar. But I would, take a closer look at those to see if even we could encourage the moat to encourage some folks to, I don't know that it's our place to reach out to people individually and ask them to apply. Maybe it is, but to at least encourage the moat to say, you know, Lewis and Clark County is looking for something similar to this, you should submit an application. I think would be helpful for us and for the folks in our community.
It would be great if the school district would apply again with something more succinct.
Mhm. Agreed.
Agreed.
Would it be inappropriate to reach out to Lana and make mention of that?
I don't think it would hurt. I would hope that she is aware, they are aware that this is open. And I would say the rest as well, including the rural schools and even the county superintendent. And I would be happy to craft a message to reach out to the superintendents of all of the schools within the county and say that we're seeking a youth prevention. If they or know of or are familiar with or have any ideas, we would love to see an application.
Mhm.
Mhm.
I was even thinking that in terms of, and this could be for us as a, for just Lewis and Clark County or even for the mode itself, but training. I mean, if there's, you know, YWCA, love it, we're gonna fund that, but if we could take that $15,000 or some other amount and bring trainers in, that could be a community-wide training. So then agencies could send all their staff. And so we could just leverage and maximize the impact of the dollars. So if somebody wanted to propose a community-wide training initiative and identify some potential trainers and some curricula, I mean, the thing is, everybody's so busy, who could take that on and organize and facilitate it? But it seems like it could be helpful. You know, maybe the Carroll College Department of Social Work could do that.
Actually, we are looking at applying because the state is cutting the training and technical assistance from all the prevention specialists. So we're going to apply to we were going to go with the large regions rather than the metro. But yeah, it would include that training piece, and you know, anybody from the communities could attend.
Interesting.
Good.
Amanda and Ann, you would be able to tell me. I think that that's a great idea, James. I don't know who to reach out to for the training. Again, I think that these are good things, and we've been trying to get some press and all of that to say there's this money available and we're trying to accomplish these tasks. So if any of you have any ideas on who to reach out to, I would encourage you to. I will craft an email at least to the county superintendents about that we're really looking for some youth opioid use disorder prevention models, training, ideas. And then I will send it to Amanda and Ann as well and ask that they then disseminate that out to the group. But I'll craft a message and send that out as well, unless you all think that it's more appropriate coming from Amanda and Ann.
I think
Oh, I
it's
think-
very, yep,
Yes, it is.
appropriate from you, Mr. Chair.
Oh, okay. Thanks. Okay, then I will do that and send it to you all. And if you all have any ideas on that, I would encourage you to as well. And James, I'll mull over your thoughts because I think it's warranted as well. And maybe the county health department could be a good fit for something like that. I'll bring that up to Commissioner Rolfe. Do you sit on the county board of health?
Yes, I do.
And maybe that's something to bring up at your next meeting. I could ask Mayor Harris as well, but maybe to bring up at your meeting that we're seeking something like that. And would the health department be interested in submitting an application? Is that something that's in their wheelhouse?
And maybe what I should do is I'll work with Amanda and Ann to make a presentation at the
I only heard that you would ask Ann and Amanda to maybe put together a brief presentation to provide to the County Board of Health.
Right.
Okay.
Yeah. Yep.
Okay. Sorry, if you're in one perfect spot, I can hear you just great. If you move at all, it's gone.
Yeah.
Well, for the sake of just transparency, is there nobody else is out there, Amanda, or Anne? So call for public comment.
Wes, I would like to just mention that on the grant we made to the detention center to bring a doctor in to write prescriptions to work with people. We just have completed a year-long commitment, about 15 hours a week. And it looks like it's all coming together really well. And I think that it's set as part of our 2025-26 budget from now until the end of June of next year. And it looks like it's going to fly very well. I'm pretty excited that it's all here. It took a while to get it done, but the money that we're putting out there is really going to be well spent, I think, on that particular project.
That's terrific. I'm glad to hear that. Yeah, I want to read to the information that was sent out by you all. I have not gotten a chance to yet, but I look forward to that and when that comes, but also we got a 6-month report from which other organization?
Mr. Chair, I believe it was just the Lewis and Clark County Detention Center that
It was
out
for
there
that one.
6 months.
Okay. Thank you.
One addition, if I might, Mr. Chair, we did hear from St. Peter's. They are wanting the St. Peter's Foundation. They wanted to apply actually for this meeting in advance of this meeting for a second year of funding. They believe we're under contract in March or February of this year, so they have not surpassed their 6-month mark. I did, regardless of the timing of this particular meeting, I said, let them know that it would be likely that this committee would want to see at least a 6-month report before considering additional funding, because we haven't heard at all about how their project is going so far. So hopefully that wasn't stepping out of bounds.
Nope.
Their particular application wasn't going to be able to be added to this meeting regardless, because we had already noticed it. But I believe they did regardless. They did submit their second year application, but they are aware that this committee may not consider it until they have made their 6-month report.
No, I wanted to compliment you on that as well, and thank you for taking care of that. And your response, I thought, was just perfect. So thank you for doing so. And yes, was not appropriate for today's meeting because it just wasn't appropriate for it. So that was terrific. So next item is an upcoming meeting. Ann and Amanda, can you tell me when the next statewide MOAT meeting is after the one? They have one in a few days or a week or so. When is the following meeting?
Mr. Chair, I'm not seeing that they have it listed on their website,
Okay.
but it looks like they're pretty close to every 3 months. So August, September, October, mid-October.
Okay. So if we met maybe the end of September, then we could review any applications and get them information. Would that work for folks to pre-schedule our next meeting?
Yes.
Yep.
Is there a day at the end of September that works for folks? Feels like so far away, but it will not be.
Yeah.
I can do I can make anything work the week of the 22nd except for Friday.
And I am not available the 25th or 26th.
Okay.
Would the 24th work for folks?
I could do something at 1 o'clock.
On the 24th?
Yeah.
Okay. 1 o'clock on the 24th?
I'm tied up in that early in the afternoon and have to be more like 2:33.
I could
Commissioner
do
Rolfe-
earlier. Oh, go ahead. Sorry.
Oh, excuse me. Commissioner Rolfe, and you might have this on your calendar, but that is the week of the MACO conference in Great Falls,
Right?
the 21st through 24th this year.
Yeah. Well,
So would the week following Tuesday the 30th?
Yep.
Anytime.
I don't have any conflicts on Tuesday the 30th. Typically afternoon works better for me. Does a 1:30 on the 1:30 on the 30th work for folks currently? Okay,
Yes.
Colleen? Yeah?
Yep.
All right, Amanda and Ann, if that works for you all. 1:30 p.m. on Tuesday, September 30th. All right. Well, unless there's anything further, any further discussion, comments?
Nope.
All right.
Nope.
Thank you all so much. Amanda and Ann, you're amazing. Thanks for keeping us all wrangled. I will go ahead and call this meeting adjourned at 2:25.
Thank you. Happy 4th,
Thanks,
everyone.
everybody.
Happy
Yes.
4th.
have a great 4th of July.
You too.
You all as well.